presentation on how to call the doctor. My name is Tara Huffman. I am the clinical coordinator here for CCU at St. Joseph Regional Health Center in Bryan. This presentation is for nursing students and new RN interns. The learning objectives for this class will be after the presentation. Hopefully you will know where the SBAR forms are, what SBAR means, when to use the SBAR form, and then ultimately how to call the doctor. I have some SBAR forms for you. This is what we use currently in our critical care unit. The SBAR forms are on FEEL, our internal system for the computer, and they're also at each nurse's station. SBAR means situation, background and history, assessment, and reminders. So if you see on your form, they're divided into categories. The first is a situation, the second is for background, third is for assessment, and the fourth is for reminders or recommendations. We want to use the SBAR form for preparation before calling, if at all possible. In the critical care unit, there are times where you may be in a hurry and unable to fill out the form. That's understandable. But I would highly encourage you to fill out the SBAR form before calling the physician, if at all possible. It's good for the MD. It's also good for report nurse to nurse. When you call the doctor, you want to use the form. Therefore, you can be as prepared as possible. You want to stop and take a deep breath. Calling the physician can be nerve-wracking, especially if you're new and trying to learn. So I encourage you to stop and take a deep breath. You want to state the facts, which hopefully you'll be prepared with using your SBAR form. You never want to apologize. When you call the doctor and you say, "Hello, sir, my name is Tara. I'm sorry to bother you," then to me it comes across that you're apologizing for doing your job. So I would encourage you highly not to apologize for doing your job. Call the physician, be prepared, be professional, call him when you need to, and do not apologize for doing your job. Another recommendation is to have another nurse by you. The nurse that's going to be by you can be for moral support, to listen to what you've said, to say anything that you have forgotten, maybe to hint to something you have forgotten, but and also to listen to what orders the physician is giving you on the phone, because you want to repeat the physician's orders once he gives them. He gives you an order, you repeat it, that nurse can also hear, especially if you're new and you're nervous. So what I'm going to do now is a demonstration on how to call the physician. This is an example of my SBAR form that I have filled out. I've put it on this piece of paper. So I'm going to stop, know that I'm prepared. I'm going to take a deep breath, and then I'm going to call the physician. So I'm going to say, "Sir, my name is Tara. I'm a nurse at St. Joseph Regional Health Center in this critical care unit. I am taking care of," this will be your situation, "a 55-year-old male with chest pain from the ER. Chest pain was resolved. Now it is recurring. Dr. Mays, your partner, was the admitting MD." Now we'll do the background. "He has a history of smoking, but no other cardiac history. He has no other history at all except he had his gallbladder removed 5 years ago." Now we'll do the assessment. "All systems are within normal limits except chest pain with movement of any type. This chest pain was relieved with nitro sublingual. His vital signs are stable and the EKGs are negative." Now we'll make our request. "May I please start a nitro drip and titrate for chest pain?" Or you can do it another way. "Is there something you would like for me to do to take care of the chest pain for this patient?" The biggest thing to do after you've called the doctor is remember that physicians are people too.